Lamotrigine carries a black box warning about what side effect? A. Dress syndrome, drug reaction, rash with eosinophilia and systemic symptoms. B. Stevens-Johnson syndrome. C. Aseptic meningitis. D. All of these. The answer is D. All of these. Lamotrigine carries a black box warning about the following side effects: Stevens-Johnson syndrome, toxic epidermal necrolysis, dress syndrome, drug reaction, rash with eosinophilia and systemic symptoms, aseptic meningitis. Phenelzin is what class of drug? A. Monoamine oxidase inhibitor, MAOI. B. Tricyclic antidepressant. C. Alpha-adrenergic agonist. D. Narcotic. The answer is A. Monoamine oxidase inhibitor, MAOI. Phenelzin is a monoamine oxidase inhibitor, MAOI. Drugs in this class work by inhibition of monoamine oxidase enzymes, the enzymes responsible for the breakdown of serotonin, dopamine, and adrenaline. What class of drugs is diazepam? A. Non-benzodiazepine sedative. B. Benzodiazepine. C. Methaqualone analog. D. Barbiturate. The answer is B. Benzodiazepine. Diazepam is a benzodiazepine. This class of drugs works by potentiating the effects of GABA, our primary inhibitory neurotransmitter, at the GABA-A receptor. Bromocriptine belongs to what class of drug? A. Peripheral dopamine decarboxylase inhibitor. B. Anxiolytic. C. Anticholinergic. D. Dopamine agonist. The answer is D. Dopamine agonist. Bromocriptine is a dopamine agonist used in the treatment for Parkinson's disease, pituitary tumors, and type 2 diabetes. A patient taking haloperidol complains of abnormal, unintentional movements of his tongue and face. The nurse knows that the patient is experiencing which of the following side effects of haloperidol? A. Convulsions and seizures. B. Neuroleptic malignant syndrome. C. Increased anxiety. D. Tardive dyskinesia. E. Dizziness and weakness. The answer is D. Tardive dyskinesia. All of the listed options are side effects of haloperidol, but tardive dyskinesia is the only one that manifests with involuntary, dyskinetic movements in their face, lips, tongue, trunk, and extremities. Tardive dyskinesia more frequently occurs among elderly female patients taking long-term dopamine antagonist medications. Dizziness, weakness, convulsions, seizures, and anxiety are also side effects of haloperidol. Neuroleptic malignant syndrome presents with fever and high, unstable blood pressure, muscle cramps and tremors, altered mental status, such as delirium, agitation, or a coma. You are the nurse taking care of a patient who is experiencing a panic attack. You are instructed to give the patient a dose of lorazepam. Which of the drug classes below describes lorazepam? A. Barbiturate. B. Alpha blocker. C. Beta blocker. D. Benzodiazepine. E. Amphetamine. The answer is D. Benzodiazepine. The correct answer is benzodiazepine, as lorazepam, also known as Ativan, is a benzodiazepine drug. Benzodiazepines act by increasing the efficacy of the neurotransmitter, GABA, when it acts upon its particular receptors. They have potent anti-anxiety properties, among other properties, and are frequently given during the initial phase of a panic attack to calm the patient. On the other hand, the other choices are incorrect. Phenobarbital is an example of a barbiturate. Propranolol is an example of a beta blocker. Tamsulosin is an example of an alpha blocker. Methamphetamine is an example of an amphetamine. METOCLOPRAMIDE is used in the treatment for which of the following conditions? A. Ulcer disease. B. Tuberculosis. C. Chronic bronchitis. D. Vomiting after chemotherapy. The answer is D. Vomiting after chemotherapy. Metoclopramide is an antiemetic and gastroprokinetic agent commonly used to treat nausea and vomiting, to facilitate gastric emptying in people with gastroparesis, and as a treatment for the gastric stasis often associated with migraine headaches. Fluorouracil is used to treat which of the following conditions? A. Myasthenia gravis. B. Rheumatoid arthritis. C. Colorectal, breast, and ovarian cancer. D. Ulcerative colitis. The answer is C. Colorectal, breast, and ovarian cancer. 5-fluorouracil is a fluoropyrimidine analog which inhibits translation, synthesis, and function of RNA and DNA, thus slowing down cellular metabolism. It is used in treatment of colorectal, breast, and ovarian cancer, in addition to cancers of the GI and head and neck. Which of the following laboratory values would indicate toxicity in the client taking acetaminophen daily? A. Sodium level of 140 milliequivalent per liter. B. Direct bilirubin level of 2 mg per deciliter. C. Prothrombin time of 12 seconds. D. Platelet count of 400,000 per cubic millimeter. The answer is B. Direct bilirubin level of 2 mg per deciliter. A direct bilirubin level of 2 mg per deciliter or greater indicates acetaminophen toxicity. The purpose of misoprostol in a client who chronically uses non-steroidal anti-inflammatory drugs, and SAIDs, is A. Decrease in serum phosphorus level. B. Relief of epigastric pain. C. Reduction of steatorrhea. D. Increased white blood cell count. The answer is B. Relief of epigastric pain. Misoprostol is used for the prevention of non-steroidal anti-inflammatory drug, HAAD, induced gastric ulcers. Taking this drug will prevent gastric ulcers and relieve epigastric pain. Clinically, abdomen is divided into 9 zones. Epigastrium is the part of the abdomen immediately over the stomach. It is located between the costal margins and the subcostal plane. The epigastric, above stomach, region contains the majority of the stomach, part of the liver, part of the pancreas, part of the duodenum, part of the spleen, and the adrenal glands. During breathing, the diaphragm contracts and flattens, displacing the viscera and producing an outward movement of the upper abdominal wall, epigastric region. It is a convergence of the diaphragm and the rectus abdominis, so that when both sets of muscles, rectus abdominis, tense, the epigastrium pushes forward. It is also the spot where the Heimlich maneuver is able to produce a rapid and forceful exhalation of breath.